My name's Katherine Oxford. I am a physical therapist and I specialize in women's health physical therapy. I have been here at Virginia Urology for 8 years and have been a physical therapist for over 20 years. I treat women that have problems with urinary incontinence, fecal incontinence, pelvic pain, urgency, frequency, as well as interstitial cystitis. I am the specialist that works with the pelvic floor muscles in order to make sure that we help to correct the organ problems, whether it's bladder or bowel dysfunction. I have been always interested in physical therapy ever since I was in high school because I was an athlete and I injured my knee. It wasn't until after I got out in private practice that I started treating more orthopedic and spinal patients and happened to be seeing more women for back pain. And as I went through their medical history and surgical history and learned more about their particular problems, then I tried to put more education and information on why they were having problems that may have included bladder problems or bowel difficulties. I started taking more continuing education courses, and from there ended up specializing in women's health through advanced postgraduate training. Since I joined this group 8 years ago, I have really enjoyed the collaborative work that we do together as a group and having access to the physicians in terms of asking questions. This urology group is very large, and within the practice, the physicians are able to subspecialize the way they would like to. So within the Women's Health Center, we have 4 physicians as well as a nurse practitioner that we work with. Because everybody has their own specialty area, once the patient is established with our group, the physicians are good about getting them to the expert that specializes in that particular situation or that particular condition. But we work really well as a team and are really here to benefit the patient. And it's nice that we're all under one roof working together. What I would encourage patients to do when they come to our office is really to take advantage of what a large group has to offer. Sometimes large doesn't necessarily mean intimidating or I'll become a number and get lost in the crowd. I still feel like there is a specific point of personal connection that we have with our patients, and we make sure that we try to address their problems and give them that one-on-one time for them to ask questions and or bring family members in if they want another person to gather information. Again, just because we're large doesn't mean that we're a factory. We really do take time and educate patients, but also provide a large number of services under one roof.